Hi everyone, welcome back to the Vision Refocus channel where we discuss all things eye health and vision related. I'm Dr. Kevin Cornwell, and today we're going to look at how allergies can affect our eyes and vision. We've all experienced those times where the eyes are super itchy, watery, swollen, and just uncomfortable. We'll look at how allergies affect our eyes in the first place and what treatment options are available. We'll also look at some actionable steps we can take to prevent these symptoms from occurring once and for all. Let's jump right in. So about half the population experiences symptoms of allergies each year, and most of us know when that time comes. These symptoms can affect our sinuses, nose, throat, and of course our eyes and vision. Ocular allergies occur when excessive levels of histamine are present in the tissues of the eye. These symptoms can include red, itchy, and watery eyes, with the eyelids being puffy in some cases. Sometimes the surface on the inside of our eyelids can become so swollen and inflamed, patients can feel like they have little pebbles inside their eyes. The clinical term we use for eye allergies is allergic conjunctivitis. This can happen for many reasons, including changes with the environment, like triggers with dust or pollen, certain medications, our diets, animal dander, and even insect bites. So what the heck is histamine? This is an important molecule produced by our immune systems to help our bodies fight allergens that we encounter, whether on our skin, our sinuses, our eyes, or even our gut. You can think of histamine as like the bouncer at the nightclub. It's responsible for a variety of processes in the body, including increased blood flow and inflammation to help fight off allergens and harmful irritants we encounter. Whether it be our itchy eyes from spring pollen or a swollen ankle from a bee sting, histamine can also be released in our stomachs based on certain foods we eat. While some histamine is good, it can easily accumulate in excessive levels throughout the body, causing all the allergy symptoms that we dread. People can also develop an intolerance to histamine, where for one reason or another, the body is unable to adequately break it down, and this causes excessive levels to accumulate in the bloodstream. People with a history of severe eye allergies may have some level of histamine intolerance. When treating allergic conjunctivitis, the first thing we tell patients is to stop rubbing their eyes. As tempting as it may be, itching our eyes only promotes more histamine to be released, thus further exacerbating our symptoms. And for contact lens users, they should discontinue their lens wear until their eyes feel better. This could take a few days or a few weeks depending on the severity of their symptoms. And for those who wear contact lenses for weeks or months at a time, should consider switching to a daily disposable lens option. Replacing contact lenses daily minimizes the accumulation of allergens and bacteria on the contact lens. If switching to a daily lens modality is not an option for you, consider switching to a hydrogen peroxide-based lens cleaning solution. These do a much better job of removing allergens from your contacts. Cool compresses to the eyes can also help reduce swelling and redness as well. A cold washcloth or a frozen bag of blueberries works great for this. We also tell patients to wash their linens and towels more frequently and consider switching to unscented detergents, as these can sometimes be a trigger for symptoms as well. The goal with treating eye allergies is to lower histamine levels in the eye. This can sometimes be achieved with just a simple over-the-counter antihistamine allergy eye drop. Unless the eye drop includes an antihistamine in the ingredients list, it likely won't provide lasting relief. Eye drops that claim to reduce redness simply constrict the blood vessels of the eye. However, they don't actually address the root cause of excessive histamine levels. Avoid these types of drops if possible. It's also important to know that some allergy eye drops can temporarily increase the size of your pupil. While this finding is completely reversible, I've seen some patients sent to the ER because their primary doctor saw different pupil sizes and thought they had a brain tumor. This is typically a benign finding and should resolve within a few hours if it occurs. Sometimes people can be extra sensitive to the preservatives in these over-the-counter eye drops, thus further exacerbating their symptoms. In these cases, they may want to switch to using a preservative-free artificial tear or have their eye care professional prescribe a low-dose topical steroid instead. Most of these are available as an ointment as well, which can feel more soothing and effective than an eye drop. I'd also like to point out that not all topical steroids are created equal, as some are more potent than others and can have a greater risk of side effects. In general, patients with moderate eye allergies should be given the least potent steroid drop first, with the stronger steroids being reserved for more severe cases. And when it comes to allergies in our diets, certain foods can also cause the body to produce high levels of histamine as well. People with a history of severe allergies can explore dietary options such as the low histamine or low FODMAP diet. These can help pin down various dietary triggers that may be contributing to their symptoms. Many people find relief reducing or eliminating things in their diet that cause excessive histamine production. Alcohol consumption is a double whammy for those with allergies. Most alcoholic products contain histamine, while they also inhibit the body's ability to break it down and remove it. Many of the low histamine diets you'll find are strict on alcohol elimination for this reason. Caffeine can also do this as well. There's also been a lot of research around the consumption of omega-3 and omega-6 fatty acids and the effects on our immune system and our allergy symptoms. The consensus seems to be that increasing omega-3 while reducing omega-6 can have a big positive impact on our allergy symptoms. This is great news for all of us who love sardines and salmon. Various recommendations exist for what the ideal omega-6 to omega-3 ratio is in our blood, but in general it's about 4:1 for optimal health. The average American has a ratio exceeding 15:1. And for those of you who don't take a multivitamin or nutritional supplements, you may want to consider doing so. I'm not going to go too deep here, but there have been various nutritional supplements that have been shown to help lower levels of histamine and reduce symptoms of allergies. So there you have it. I hope this video provided some more information on how allergies can affect our eyes. I'm curious to know if there's anything that you've done to treat and prevent your symptoms of eye allergies that we did not cover in this video. If so, please feel free to share with us in the comments below. For more information about eye health and vision, feel free to check out the other videos on our channel and subscribe. Thanks again for watching, and we'll see you in the next video.